Hey Neuro friends, this is Erin Gallardo here. I just wanted to pop in for a quick video on a topic that's been coming up quite a bit in our neuro community, and something that I know for sure is an area that affects all of us as neurotherapists. And it's definitely something that for me has been frustrating and confusing and irritating and agitating and all of those things. So it's something I've wanted to learn more and more about and have a better understanding with, so ultimately I can serve my clients better. And I want us to have a good conversation about it because I know you all want the same thing for your clients and you want them to reach all of their goals. So that topic is wellness versus therapy in the neurologic population. And of course, you know, the reason this is really complicated is because our neurologic clients can be pretty complicated and it's not so straightforward like in the able-bodied population when someone's done with therapy, when they're doing wellness and the different needs that they have. So it's a really important area for us all to learn more about and get on the same page about so we can really operate all at our highest potential, right? So I wanted to share my top 3 tips for navigating wellness versus therapy in the neurologic population. So tip number 1, get a clear understanding on Medicare's rules for medical necessity. So you want to understand the difference between therapy and wellness. And the reason we need to know the difference is because of Medicare. So we don't care, personally, about the difference really, but we need to know and we need to care because we're operating in Medicare's world. So you want to get a clear understanding of when you're doing therapy and when you're doing wellness, and the way you do that is by understanding what is required in medical necessity. So you want to understand, for medical necessity, there's a level of complexity and skill that is required when you're doing skilled therapy. That would be under Medicare's rules, medically necessary. There is a reasonable time frame that you need to be working with your clients within and making progress towards functional goals. So not any recreational goals, but functional. And your patients need to be able to demonstrate that they're having self-management. So doing their home program, doing other exercises, having caregivers assist them, committing to the plans that you set for them. So that's tip number 1. Get a really clear understanding of what medical necessity is and what's the difference between what Medicare would consider medically necessary therapy and wellness, which would be anything that they would not cover. Okay, so tip number 2, start a conversation with your clients about this on day 1. So I've made the mistake a lot of having long-standing clients that were just used to seeing me for therapy once a week forever and ever and ever. And that's really not medically necessary or reasonable in the time frame, right? So it's really much easier if you start a conversation with your clients on day 1 about what to expect. So help them understand the rules of Medicare. Let them know these are Medicare's rules, not yours. You're not the bad guy. You just want to help them in the best way possible. And we're living in Medicare's world, so we need to play by their rules. So help them understand. Make sure you have a conversation about how often you expect to be seeing them, the frequency of visits, how many weeks you expect. You know, this can always have some wiggle room, but give them an outline of what you think and then what you recommend for after so that there's no surprises. Start talking about that early on so they can feel committed to the goals that you two are working on together, the time frame, and then start expecting what's going to happen once that's over. If you start this early, it's going to make that transition so much easier and you're going to be much, much happier, and they're going to feel happier too because it'll be a lot clearer. So that's tip number 2. Tip number 3, always keep your client's needs in mind. Always operate based on what they need versus feeling stuck in your own head, in Medicare's head, in their rules, or anything like that. You really owe it to them to give your recommendation of exactly what you think they need in order to get their life back. So what that means is, you know, someone's coming to you. You have an advanced degree. You may have even your specialty certification. You have training and years of experience. So you know what they need, and you need to recommend exactly what they need without feeling burdened by, oh, I don't know if they can afford this, or, oh, why can't it just be covered, everything under Medicare? You know, you can't really operate like that because then you're not giving them exactly what they need to know in order to get better. You need to provide them the recommendations, Tell them what you think that they need. If you have options for them to do wellness, personal training, classes, anything like that, whether it's with you or in the community, provide those options for them and let them know so that they can decide whether or not they want to do it or they want to prioritize that or not. You really don't want to be the thing that gets in the way of your clients reaching their full potential. So always keep them in mind. Don't let your fears hold you back, or your assumptions of what your clients can and cannot do, can and cannot afford, would or would not be interested in, hold you back from actually giving them your recommendation for what they truly need. So those are my top 3 tips for working and navigating through wellness and therapy in the neurologic population. And I'd love to hear your thoughts on these tips. And obviously there's a lot more we can expand on and have conversation around so that we can all learn and grow. If you haven't joined us in the Facebook group, the Neurocollaborative Professionals Facebook group, make sure you join that, ask your questions, start conversation around it, share this with anyone you think might benefit, and can't wait to hear more from you, what you guys have learned, what you're implementing in your practices to help your clients understand these kinds of things, and so everybody wins. All right, I'll talk to you later.